room scan. Ceiling, ears. Good afternoon. My name is Megan Marsh. I'm a nurse practitioner at Auburn University. Today I will be doing a head-to-toe assessment on Miss Janet. Before we get started, I've already washed my hands and everything for this video. I'm going to repeat 3 words, and I want you to recall them at the end of this video, okay? It's going to be green, run, and car. Green, run, and car. Okay. All right. So Miss Janet, she is an adult female. She is tall in stature. She is not obese. She does not have any odors. She is well groomed, well dressed for the climate today. So I'm going to start with, can you tell me your name?
Janet Paul.
And where are we at?
At the hospital.
And who's our president?
Joe Biden.
What year is it?
2023.
Perfect. So patient is alert and oriented ×4. Now we are going to start with inspecting your head. I'm just going to palpate. Let me know if you have any tenderness. Her hair is evenly distributed throughout. There is no flaking of the scalp, no lesions, no lice. I'm going to go ahead and palpate your sinuses. Tell me if you feel any tenderness in your maxillary, frontal, upper cuss. Any tenderness?
No.
All right, so no tenderness. There's no swelling of her frontal or maxillary sinuses. Her skin is warm. It's dry. Color is appropriate for ethnicity. We're going to look at her nails. Cap refill is less than 3 seconds, so that's good. And the skin trigger, there's no tinting of the skin. Now we're going to move into your eyes. There is no drooping of her eyelids. Her sclera is white. There's no drainage. Her conjunctiva is pink and moist. I'm going to go ahead and look with my light and just look ahead for me, okay? Okay, and that's just testing the light reflexes in her eyes. They are slightly visible, nasal to pupil. Now, can you puff out your cheeks for me? Can you smile? And close your eyes. Open. Perfect. And smile real big and frown. All right, so cranial nerve 7 is intact. Now let's go into your TMJ. I'm going to palpate that. Let me know if you feel any tenderness. Open your mouth. Okay, there's no popping. That's good. No swelling. Clench your teeth. Perfect. And then I'm going to have you close your eyes. I'm going to touch your face with something sharp and something dull. I want you to tell me which one's sharp and which one is dull.
Solid. Sharp. Dull. Sharp. Dull.
All right, so cranial nerve 5 is intact. Now let's go ahead and do your lymph nodes. I'm going to palpate your pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, your supraclavicular and infraclavicular. Any tenderness?
No.
All right, so there's no tenderness. Lymph nodes are mobile and discrete. Now I'm going to have you, we're going to pretend this is our Snellen chart, okay? So I'm going to have you hold this about, 12 to 14 inches from your face, and then you would read the bottom line, and your vision is 20/20, okay? All right, so now let's go, and that's testing your cranial nerve 2. Now I'm going to move into your nose, It is symmetrical. I don't see any lesions. I don't see any drainage. I'm gonna palpate for tenderness. Any tenderness?
No.
Good. Now we're just gonna, we'll look inside later. Let me finish looking into your eyes. All right, so just look ahead for me. Perfect. Okay, everything looks good there. So I don't see any bleeding or anything in her retinal background. Everything is visualized. Everything's intact. The optic disc is round, yellowish, orange in color. It's well defined. And then the macula and fovea centralis are visualized. Now I'm gonna go ahead and test cranial nerves 3, 4, and 6. Can you look at my finger and follow it with just your eyes? Okay, so they do accommodate, and that was testing cranial nerves 3, 4, and 6. I'm gonna have you cover one eye, uncover, and the other, uncover. All right, so that was the cover test. There is no leg lag or nystagmus to either eye. Now, we looked at your pupils. They were equal round reactive to light. That was cranial nerve 3 as well. Now I'm going to look in your ears and finish looking in your nose. All right, so I'm going to finish looking in your nose, okay? And I'm not going to stick it all the way in because I haven't looked at your ears yet. So. Her nose, the septum is midline. There's no deviation, no drainage, no nasal polyps or anything like that. So ears, I'm just going to palpate. Any tenderness there? All right. No drainage. I don't see any lesions or sores. We're just going to take a look in her ears here. The tympanic membrane is pearly gray. The cone of light is seen at 5 o'clock. A little bit of honey-colored cerumen, but nothing to worry about there. Now I'm going to go ahead and look into your mouth. Her lips, there's no cracking, no edema or swelling. I'm going to have you open your mouth for me. And say, ah. And the uvula rises with all. That is cranial nerve 9. Her tonsils are not swollen. Her pharynx, there's no exudates or redness or swelling in there. There's no missing teeth. There's no cavities. Her tongue does not have any sores. It's pink, it's moist, no discoloration. And her, go ahead and stick out your tongue and move it from side to side and up. Perfect. And then the stensons and sublingual ducts are visualized. And then we would go ahead and test her gag reflex, but we're going to spare her that. That would be testing cranial nerve 10. Go ahead and swallow for me. All right, and so cranial nerve 10 is intact. Now let's go ahead and look at your throat. It is midline. I'm going to palpate for any tenderness. No tenderness?
No.
Perfect. And then I'm going to have you shift a little bit. I'm going to check your thyroid. All right, and go ahead and swallow. Perfect. So her thyroid rises, or I felt it as she swallowed. There's no borders present. Like I said, her trachea is midline. Everything is symmetrical. There's no scars or lesions or anything like that. Now I'm going to have you shrug your shoulders. All right. And then push against me. All right, so that was testing cranial nerve 11, that is intact. Go ahead and put your chin to chest and back and ear to your ear. All right, and then there's full range of motion in her neck. Now let's move into, go ahead and, forgot to check something on your nose. Go ahead and hold and sniff. Perfect. Other side. Perfect. Close your eyes, and then I'm going to have you smell something, and you tell me what that is.
Alcohol.
Yes. Good. So that's cranial nerve 1, that is intact. And now let's go ahead and move into your respiratory. Just upon inspection, she is not using any accessory muscles to breathe. Her respirations have a regular rate, rhythm, and depth. There's no, like I said, use of accessory muscles or intercostal retractions while she's breathing. So I'm going to have you turn a little bit. All right, so we're just going to palpate for any tenderness back here. Any tenderness?
No.
Good. Now we're gonna percuss, but we're just gonna do one side for the purposes of this video. And upon inspection, I don't see, any deformities. There's no abnormalities, and she's not having any trouble breathing. Are you short of breath?
No.
Good. So I'm gonna go ahead and percuss apex to base. Tell me if you feel any tenderness with that as well.
No. 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 No.
All right, so there is resonance throughout. I don't hear any dullness or anything like that. We're gonna go ahead and listen with our stethoscope. So while I'm back here, I'm gonna go ahead and palpate the CVA tenderness. Tell me if you feel any tenderness here.
No. No.
Okay. And we're just gonna listen with our stethoscope. You would listen with both the belt and the diaphragm. Perfect. And you're going to listen side to side so you can compare each. You won't do straight down. I'm going to move ahead and go on to the front. Tell me if you feel any tenderness.
No.
Good. Now we're going to percuss the front as well. All right. No there is resonance throughout. I'm going to listen. All right, so breath sounds are clear, no adventitious sounds or anything like that. And now we're going to go ahead and move into, let's see. Oh, wait a minute. So I did forget to check, or let you guys know that her AP ratio is 2-to-1, so that's normal. And then we also need to check the expansion. So go ahead and breathe in. All right, and that is equal bilaterally. I'm gonna repeat the word, or I'm gonna repeat 99, or you are gonna repeat 99 when I move my hands. Okay?
Okay.
Go ahead.
99. 99. 99.
Okay, perfect. So there is no fremitus or anything right there. Now we're going to move into cardiovascular, I think. So patient's color is normal, appropriate. Like we said, her cap refills less than 3 seconds, so her circulatory system looks good. I'm going to go ahead and listen and palpate. Do I don't feel any thrills, no heaves. All right, apical, pulmonic, herbs point, tricuspid, and mitral. All right. And you would also listen standing and sitting. I'm going to go ahead and palpate the PMI. It is at the fifth intercostal space midclavicular line. All right, and there is a good pulse there, regular rate and rhythm. I'm going to go ahead and check her carotids. Good strong pulse there. I'm going to listen with my stethoscope for any bruits. Also listen to the temporal. And I don't hear any bruits or anything there. Now we are, oh, and there's also no JVD noted upon inspection. Now I'm going to have you go ahead and lay down for me. All right. So now we're gonna just inspect her abdomen. I don't see, well, we would have her shirt up, but for privacy purposes of this video, we're not gonna do that. I would inspect her umbilicus. It is midline, no sores, lesions. I would look for anything like that or masses that would stick out. So first we are gonna listen with our stethoscope. Alright, and you should have about 20 per minute, and those bowel sounds are normoactive. Now we will go ahead and percuss, and let me know if you have any tenderness, okay?
Okay. No. No. No.
Okay.
No.
And then we are gonna go ahead and percuss over the liver.
No.
So when you get to the dullness, then you will measure. It should be about 7 centimeters for her liver. Now we're going to go into a soft palpation. Let me know if you have any tenderness.
No.
Okay. Now deep palpations. The same thing. Let me know if you have any tenderness.
No. No.
Take a deep breath in. Okay.
No.
Deep breath in. All right. So I did not, she does not have any tenderness. I did not palpate any abnormal masses or anything. I could not palpate her spleen or her liver, which is good. Now we're just going to palpate the kidneys. And, all right. So that is not palpable as well, so that is good. There was tympani throughout. Now we are going to listen to her aortic, iliac, renal, and femoral with the bell. Aortic, renal, iliac, and femoral. You would listen to those arteries. There are no bruits. We would also go ahead and palpate her inguinal and femoral nodes, but for privacy, we will not do that, but they should be mobile and discrete. Now we're going to go ahead and move into your breast. we're not obviously going to do a regular breast exam. I'll just go ahead and explain it. You would raise one arm up. You would do it around the same time each month. I'm going to palpate a little bit.
Okay.
You would palpate your armpit, feel for any swollen lymph nodes, anything that feels like a rock or a pebble. You would start in the telesphinx, and then you would go down, and you could either go around or side to side towards the nipple, and you would just, like I said, feel for any masses or lumps in there, or any tenderness, and you would also check for nipple discharge, and all that's good. So I believe we are done with the breast and cardio. We're just going to go ahead and move into the musculoskeletal system. I'm going to palpate your joints. Tell me if you feel any tenderness in your shoulder,
No.
elbow.
No.
All right. What about your wrist?
No.
Fingers?
No.
All right. Knees?
No.
And your ankles?
No.
And your toes?
No.
All right, so patient is non-tender. You would do this on each side. Everything you would do on both sides for this video, but we're just doing one. So there's no tenderness in her joints. There's no crevitis. I don't feel any, edema or fluid in those. Now we are going to test your pulses. So your radial, your popliteal, posttibial, and dorsalis pedis. Okay. Now I'm gonna have you go ahead and lift your arm and down, and then away from you, down. I'm gonna have you sit up actually to finish this part. I'm sorry.
It's okay.
And then raise it all the way up and behind you. Perfect. So there's full range of motion in her shoulder. Was there any pain? No pain. Full range of motion, and then go ahead and put your arms out and supinate, pronate, perfect. And then I'm gonna keep your arms up, push against me. Perfect. Strength is 5 out of 5. Full range of motion in her shoulders. Go ahead and bend your elbows up and extend. Perfect. And then up again. Push against me. Hold. Perfect. Strength is 5 out of 5 in her elbows. Full range of motion. Let's do your wrists and your hands. She can rotate up, down, side. Perfect. Fingers. Good. And now grip strength is 5 out of 5. Full range of motion in her hands and wrists. Now let's go ahead and check your knees. Push against me. Perfect. And bring it up and down. Sorry, I'm gonna have you lay down again.
That's okay.
All right, and now put your knee up again, and then kind of out. Yep, invert, in. Yep, perfect. All right, and there is full range of motion there in her hips and pelvis. Go ahead and stand up now for me. And then push against me. Strength is 5 out of 5 in her knees, and let's go ahead and push like a pedal. Good. And then push up. Perfect. Strength is 5 out of 5 in her feet as well. Go ahead and bend down, up, out, in, and around. Full range of motion in her feet and ankles. We would check her calf refill and her toes as well. It would be less than 3 seconds. Go ahead and stand up for me. We're going to check your spine. Go ahead and bend over. We're going to palpate for any tenderness. Any tenderness? Okay, good. spine is midline. I don't see any curvature, so there is no scoliosis there. You can go ahead and bend up, sorry. You can go back. And then side, side, twist. All right, so there's full range of motion of her spine as well. Now we are gonna just go into and check her reflexes. Oh. All right, so first we're gonna check your bicep. All right, and then your tricep, and just kind of relax your arm there. Perfect. Hold you, and then brachioradialis, and then your knee. All right, and then your Achilles. All right, so all reflexes are 2+ normal in all extremities. Oh, now we're gonna do your Babinski. That is negative. Did that tickle?
Just a little bit. Sorry.
All right. So that was the end of the musculoskeletal. Now we're going to go into her nervous system. So she's conscious, she's alert, she is oriented, she has followed all of our commands appropriately. Do you recall the 3 words I told you at the beginning?
Green car run.
Perfect. So her memory is intact. And go ahead and close your eyes for me. I am going to touch your extremities. I want you to tell me if you feel sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Sharp.
Okay. So that her motor function and her sensations are intact. I'm gonna put my finger up, touch your nose, and touch my finger. Keep going. Here you go. Perfect. All right. And then take your heel to toe and slide down. Heel to toe and slide down. Yep, on each side. Perfect. Motor function is intact. And now I'm gonna have you close your eyes again. I'm gonna draw something in your hand. Tell me what it is.
A.
Perfect. And keep your eyes closed. I'm gonna put something in your hand. It's a familiar object. Tell me what you think it is.
A pen.
Good. So patient answers appropriately. So her stereogenesis and her graphesthesia are intact. And I'm gonna have you stand up. And heel to toe. All right, good. So she is walking with a steady gait. Stand there for me and close your eyes. And you want to make sure that there's no swaying. And we're testing the Romberg, and it is negative. All right, you can have a seat.
Sure.
And I believe that concludes our assessment today. Thank you.
Thank you.